is Stacey Bledsoe. I am the advisor for clinical trial diversity at Eli Lilly and Company. My job currently is to ensure that our clinical trial diversity strategy is moving forward and progressing external to Eli Lilly. My journey started about 2015 with my dad. And so my dad was diagnosed with lung cancer. And at the time I asked his physician about clinical trials as an option, a treatment option. She informed me at the time that she had no information about clinical trials, and in fact, she would have to go look for additional information. She soon came back and informed me that there was little information for her to share. And so I went back internally to Lilly and talked to my leadership about how we could change this and what we could do as a company to move this topic forward. I started grassroots efforts working with Lilly colleagues across the company with the blessing of my chief medical officer to better understand what we as a company could do to move this topic forward for our patients and our clinicians that prescribe our drugs. Here at Lilly, we have 3 goals around diversity in clinical trials. Number 1, we want to increase the diverse representation of our patient population. And what we mean by that is if we have 12% African American women who have breast cancer, we should have 12% African American women enrolled in our trials. Number 2, we want to ensure that we have diverse sites, diverse investigators, not just from a racial ethnicity perspective, but also from a gender perspective. And number 3, we're building partnerships. We know we can't do this alone. And so we're working with partners such as Tigerlily to ensure that we become a trusted partner in the community. And so we're out here talking about our trials. We're doing things like educating African American patients and communities of color about clinical trials and what that includes and how to get involved. And so we are really going into the community to do things such as mammogram buses and community outreach to really talk about how to get involved in clinical trials, not only for you, but for the greater good of the community. A lot of patients assume that they are guinea pigs, that they are not protected. And honestly, a lot of this started with the Tuskegee syphilis experiment that happened early on for many African Americans in the South. And so as a result of that experiment that went well into the 1970s, there's a level of mistrust, especially in communities of color and specifically African American communities around this mistrust. For us, it's about helping patients to understand that as a result of Tuskegee and other things that have happened, such as the Henrietta Lacks issue that has occurred, we have put things in place that protect patients. And so we are hoping to communicate that, build a level of trust with our patients and our partners to help them understand that we are here to help the community, answer any questions that may arise, and understand that there are policies, procedures that are in place to protect patients first and foremost from any type of experimental treatments and things such as that. And at any time, your physician is there to address any concerns that you may have. Every pharmaceutical company has 1-800 lines where you can ask questions. I just encourage you to do your research and just consider it as an option.